Hi, I'm Dr. Bryce Barfus with Summit Dental Care. I'm here today to talk to you about cone beam technology. We have 5 core values in our office, and one of those core values is innovation, which means that we believe that we need to have the top quality products of equipment to be able to better service our patients that we serve. And one of those pieces of technology that we have is called the cone beam. Cone beam is a X-ray that we take. It's a 3-dimensional X-ray that allows us to see different dimensions of the teeth, of the bone, the anatomy of the head, so that we can diagnose and better treat all of our patients. It allows us to have the views from top down, side to side, and front to back, so we can see in all directions. There's a lot of things that we can't see 2-dimensionally or see clinically, and so this allows us to really take a deep dive into things and allows us to better diagnose and better treat everybody that we serve. So the difference between 2-dimensional and 3-dimensional X-rays is, on this model, if we're taking a 2-dimensional X-ray, it's only going through the plane right here. It's only going through this way. So all we can see is what we see right here. We can't see the backside or the end of the root as well. But what we can do is we can imagine these teeth coming out just like this right here. And with the cone beam technology, we can take a look all the way around. So we can take a look at the outside, the top, the inside, underneath the tooth, all the way throughout, and look at the roots. So top down, side to side, front to back. We can take a look everywhere. So it gives us a lot more ability to visualize what's happening with the tooth, and what's happening with the root, what's happening with the bone, all the structures around it. So this is the 2-dimensional X-ray right here that we look at, kind of gives us a general view of what's going on. And then this right here is a 3-dimensional. I'll enlarge this right here. So what we can do is we can scroll through this and really look at all the anatomy, everything that's going on with the jaws and with the teeth. It gives us a general view of what's happening. These other 3 windows over here give us a view of the longitudinal, cross-sectional, axial. What that means is this window right here, we can scroll through from outside to inside. So we go from the outside to inside. You can see right here, there's some teeth right here, some roots right there. These 2 are implants, roots right here. So we just scroll back and forth looking at any variation from anatomy. So that's one view that we have. Another one is the cross-sectional view, which goes from front to back. We can scroll from the front right here, and then it scrolls all the way through to take a look going from the front to the back. And then the other view that we have is the axial view, which would go from the top and we go to the bottom. So we can go all the way up into the sinuses, where we look at the sinuses, the air-filled spaces that are up in the jaws, and go all the way down and look at all the roots of the teeth, all the way around right here. We can look at the airway. We can look at a lot of anatomy that's right there. And so if there's anything that's out of normal or abnormal or from what we consider normal, then we take a look at that and say, well, what's going on there? And we need to diagnose that and talk to the patient about what we see. So what we can find in 3-dimensional X-rays versus 2-dimensional X-rays is a lot of variations of anatomy or some pathosis or disease that's happening that we don't normally see. So for example, this is a 2-dimensional X-ray. I can't scroll in and out right here, but I can look at the roots right here. But when we take a closer look at the roots here or the roots of these implants right here, if we go to a different view, we go to this view, I can see the inside. On 2-dimensional X-rays, I can only see from this view going right here. But from a 3-dimensional view, we can take a look on the inside, we can take a look on the top and see what's happening. We can take a look at the sinuses. Like right here on the 2-dimensional X-ray, it really doesn't show that the sinus is filled up with mucus or with pathosis. But right here, we can scroll in and out and see how clear that sinus is. If it's filled with disease, then we know that there's some infection or there's sinusitis or there's something else that's going on. With the 2-dimensional X-ray, we can't always pick that up. So it allows us to see from all dimensions, outside, inside, top to bottom, just a lot of different things. In the past, we've been limited on what we can do in dentistry because we've been limited on what we can diagnose. But now we're not really limited on what we can diagnose because we have this piece of technology available to us. So if you have any issues or any concerns, come to Summit Dental Care. We have a wonderful team that will help resolve any concerns or any questions or any issues that you may have. Thanks so much.